Good day, everyone. My name remains Matthew Ocheleka Itodo, a lecturer with Federal University of Health Sciences, Otukpo, Benue State. I'm here to take you in the topic glucose tolerance test. But as a point of introduction, we'll be looking at glucose itself and oral glucose tolerance test. Now, we start from glucose. We said glucose is a monosaccharide consisting of 6 carbon atoms. Glucose is not the only monosaccharide that have 6 carbon atoms. We also have galactose, we have lactose, we have fructose. These are 6 carbon atoms, but they might have different functional group and positions of hydrogens differ. But they are all 6 carbon atoms. And so to continue, we'll be looking majorly on glucose because of the energy level supplied by glucose. And mainly is a glucose that is used to generate ATP. So we proceed. Glucose is a common sugar that is necessary for human metabolism. Basically, glucose is a sugar that the body uses for energy. So, for the body to be able to do its work properly, a monosaccharide, especially glucose, in our diet, after the body have able to absorb the nutrient glucose from our diet, the glucose will be in the bloodstream, and insulin need to do its work for the glucose to get into the cell. It is in the cell that the glucose is converted into ATP, which is the major energy source for the body. So now we'll be looking at glucose homeostasis. Now by homeostasis we are talking about the self. By homeostasis we are talking about any self-regulating process by which an organism tends to maintain stabilities while adjusting to conditions that are best for its survival. In an environment, there is a lot of attack, a lot of unfavorable conditions to an organism, and the organism must survive. So homeostasis now will help the organism to self-regulating the process to maintain stability and then be able to adjust itself to the environment to survive. So if homeostasis is successful, the life of the organism continues. But if homeostasis is not successful, the organism dies. So it means glucose homeostasis is very important. The organism needs to be stable for life to continue. And so in this glucose homeostasis, we'll be looking at 2 major hormones that have a very important role to play. One of the hormones is insulin, and another one is glucagon. And both of them are secreted from the pancreas. While insulin is secreted from the beta cell of the pancreas, the glucagon is secreted from the alpha cell of the pancreas. And they play major roles in glucose homeostasis. Now let me give you the background of this insulin. Insulin is a hormone that acts as a doorway for glucose to enter the cell and converted. We earlier said that insulin is acting as a doorway for glucose to move from the bloodstream into the cell to generate ATP. While we said glucagon is also a hormone, but it helps the glycogen that is stored in the liver to be converted back to glucose. So he made sure he prevent the depletion of glucose out of the bloodstream. So he prevent the lowering of the glucose at the bloodstream. He made sure the glucose at the bloodstream is at the increase, while insulin is to take the glucose from the bloodstream into the cell. So while the glucagon is to make sure that there's enough glucose in the bloodstream, the insulin is to make sure that the glucose gets into the cell to generate ATP. And also, insulin also assists to signal the liver to store glucose when the glucose in the cell is enough. When there is enough glucose in the cell to generate ATP, he will signal the liver, insulin will signal the liver to say, store more glucose, store more glucose. And while glucagon now will break down the glucose from the liver, the glycogen in the liver into glucose. And the process continue. The process continue for life to continue. That is what we are talking about, glucose homeostasis. And any abnormalities in this glucose homeostasis result in several clinical disorders. And the most well-known that we'll be talking about is diabetes mellitus. Now, we are proceeding. Then what is this diabetes mellitus? We say that, what is this diabetes mellitus? We say that diabetes mellitus is one of the disease conditions in which the blood glucose in the body is not regulated. There is high blood glucose in the bloodstream and the body is not able to regulate it. And in the case of this diabetes mellitus, also insulin is not secreted, because if insulin is secreted, the glucose in the bloodstream will not be high, because the glucose will move into the cell, which is used for generation of ATP. And then in the case of this diabetes mellitus, one of the symptoms that you can see is what? Frequent urinations by the patient. So, and we are looking at oral glucose tolerance test, and we are looking at it that the diagnosis of type 2 diabetes mellitus is majorly done by this oral glucose tolerance test. And it's in the case where the fasting blood glucose is the standard test. Now, what we mean is this. In the case of diabetes generally, either type 1 or type 2 diabetes mellitus, fasting blood glucose is the standard test, which the person is to fast and then you come for the test, and the blood will be collected and the test will be carried out. And the level of the result will show if it is diabetes or not. But in the case of oral glucose tolerance test, the fasting blood glucose standard test is still need to be proved. So to prove the result, we need to carry a further test. So that will be a case of oral glucose tolerance test to prove the fasting plasma glucose, which is the standard test. We do another further test, and that is when we can talk about oral glucose tolerance test. However, there is another functional test which can give, now listen carefully now, there's another functional test which can give more details on glucose homeostasis in the patient. Glucose tolerance test. There are two major types of glucose tolerance tests. We mentioned oral and intravenous. In this case is that, let me give you the basis. What we are talking in this case is that, in the case of glucose tolerance test, you first of all do fasting glucose test, which is the standard test. For further verification, for you to be sure, to confirm that the patient is diabetic, now you carry out oral glucose tolerance test. And the oral glucose tolerance test, there are two major ways the test can be done. We talk about oral and we talk about intravenous method. The oral test is where the glucose drink or powder glucose or glucose salts will be given to the patient and the blood will be collected. And the test will be examined in 1 hour and in 2 hours to show the level of the tolerance. So it is orally, the glucose is administered orally. While the intravenous, the glucose will be administered intravenous through injection, and then the blood glucose will be checked. Having given you the background, then what is glucose tolerance test, GTT? This is usually referred to as oral glucose tolerance test. Glucose tolerance test measures the ability of the body to tolerate a major dose of glucose. The rate of glucose absorption and response of insulin mainly determine the extent of the glucose tolerance, as shown by the change in the level of the blood glucose. When there is a rise in blood glucose, insulin is released from the pancreas to lower the glucose level. Tolerance is reduced when insulin is absent or insufficient. So the blood glucose tolerance test, the amount of blood that is in the bloodstream. If insulin is released from the pancreas, it will lower the glucose level. Now, look at it now. Tolerance is reduced when the insulin is absent or insufficient. If the insulin is not sufficient to do its work, or the insulin is absent, the glucose will be more abundant. There will be high blood glucose in the bloodstream. So, a rise in blood glucose value usually occurs after having a meal containing carbohydrate. Therefore, the response to carbohydrate level depends on the previous carbohydrate diet and on the amount ingested. The effect of ingested carbohydrate is the basis of the glucose tolerance. It simply detects abnormality in the carbohydrate metabolism and in the case where glucosuria has been found. Now, listen carefully. When a meal of carbohydrate has been ingested or any other source of carbohydrate food has been eaten, now there will be high blood glucose in the bloodstream. Now the tolerance now is, how is the body able to tolerate the amount of glucose that is ingested? That is what we'll be talking about. Fasting plasma glucose is the standard test for the diagnosis of diabetes mellitus. However, there is another functional test which can give more detail on the homeostasis of glucose in the patient. So, fasting plasma glucose, that is a standard test, is not enough to confirm if the patient is diabetic. Now we'll be looking at the principle of oral glucose tolerance test. And this principle we have earlier established that glucose tolerance test is used for diagnosis of diabetic mellitus and related other disease. And we have also established that fasting plasma glucose level, the test will be carried out after overnight fasting to check the glucose level if it is at the normal range or above the normal range to indicate if the patient is diabetic or not. But it is not enough to use the result. A further test can also be carried out. That is when we have a case of oral glucose tolerance test. Having said that, now what is the principle of this oral glucose tolerance test? This is the principle in which the test is based. Now the overnight fasting blood glucose is collected and the result will be carried out. And the normal range will be established. Shortly after the test carried out using the blood, a 75 gram dose of glucola. Glucola can be glucose drink, it can be glucose powder, or any other source of glucose, will be given to the same patient and then waited for 2 hours again to make sure that the glucose move into the bloodstream, and another blood will be collected again, just like the first one collected. And now a test will be carried out, and then they will check for abnormally high fasting glucose value that is not able to return to normal. If it's not able to return to normal, it indicates there is a decreased tolerance to glucose, and that will be a support to diagnosis of impaired tolerance, which will be a provisional diagnosis of diabetes to confirm the person is diabetic because is not able to return to the normal. But if it returns to the normal, means the person can tolerate the amount of glucose, and so the patient is not diabetic. This is the standard principle to follow to conduct oral glucose tolerance test. We proceed. Clinical significance of oral glucose tolerance. What is the clinical significance? It is very important method of screening and diagnosis for diabetes. That is the major clinical significance of oral glucose tolerance test for screening and diagnosis of diabetes mellitus. And this is how it is done. To further explain that, it also helps to measure the body. To measure the body is able to store glucose by removing it from the blood. So it will check that a major amount of glucose, I give instance of that 75 gram glucola or glucose drink or glucose powder given to the patient, and allow it to move into the bloodstream. Now it will make us to check the amount of the glucose that is able to be stored in that bloodstream, and also to check how the insulin is able to remove it from the bloodstream into the cell for energy generation. So this test measures the plasma response to an intake of this 75 grams of concentration glucose solution, usually at 1 hour and 2 hours. So the result after the dose of glucose has been taken, the blood can be collected at 1 hour. You check the result. It can also wait for another 2 hours, collect the blood and check the result, compare this result, and then compare it with the normal. If it's able to return to the normal range, means there is glucose tolerance, so the person is not confirmed diabetic. But inability to return to the normal, in this 1 hour and in 2 hours you check, then confirm the impairment of blood glucose tolerance test. the impairment of blood glucose tolerance. So we are moving ahead. If the patient has a normal glucose tolerance, blood glucose level return to normal within 2 to 3 hours after ingesting the glucose. Since people with diabetes cannot respond to an increase in blood glucose through the release of enough insulin to cause storage, their level of blood glucose rise above what is observed in normal individuals and can stay elevated for a longer time. So these are the basis for the test to establish that the patient have impaired glucose or a normal tolerance. Oral glucose tolerance tests identify abnormality in how the body handles glucose after a meal, often before the fasting blood glucose level become abnormal. So a patient can just consume a meal of carbohydrate. How will he be able to handle this glucose now that the meal has been taken? How is he able to handle it? Now, this oral glucose tolerance test is mainly used in obstetrics. When we are talking about obstetrics is a branch of medicine and surgery that is concerned with childbirth or midwifery. That's what we refer to obstetrics. So we say it is used to screen pregnant women. So this obstetrics, the obstetrician that practice this, they use this oral glucose tolerance to screen pregnant women to check if there is a trace of gestational diabetes. And the pregnancy will be between 24 and 28 weeks. That is 6 months to 7 months of pregnancy. At that stage, the obstetrician can check if there is a case of gestational diabetes. So in checking for this gestational diabetes, one of the best approach is what? Oral glucose tolerance test. And also in the case of thyrotoxicosis, that is the hormones responsible for the case of the swelling that we normally see in patients at their neck regions. So this hormone thyroid, the overproduction of these hormones will result to this thyrotoxicosis. And a good symptom of it is the swelling that we normally see at the neck regions, because there is overproduction of the hormones thyroid. And in the case of liver disease or infection, this oral glucose test can also be carried out. So, and also in the case of patient having glucosuria, means the presence of reducing sugar in urine, frequent urination, and then with a trace of glucose in urine, oral glucose tolerance test can also be carried out. So, we are moving ahead. Or a person with family history of diabetes but no advanced diabetes. The family history is that they are exposed to diabetes, but there is not a signs or symptoms of diabetes in the patient yet. This oral glucose tolerance test can also be conducted to check if there will be further cases of diabetes in a particular individual. Patient showing evidence of neuropathies. This is the case of numbness of the feet or numbness of the feet or of the hands, or where the body, the leg or the hands is no longer feeling as if it is alive anymore. So that is a complication of diabetes mellitus. or in the case of retinopathy, where the blood vessel behind the retina have been damaged, and then there was now problem to visions. It's also a complication of diabetes. So we can check oral glucose tolerance test. So take notice of all the cases that we have mentioned that can give room to glucose tolerance test. But the major thing I say here is for screening and diagnosis for patients, and these are the following patients have been listed. Now we are moving ahead to the reference range to show that this is a normal range for glucose, and this is the normal range for impaired fasting glucose. Now the reference is all glucose tests are reported along with the following comment. Reference range based on the American Diabetes Association clinical practice recommendation. So this association, American Diabetic Association, they have come with clinical recommendation. Now this is how now we are talking about glucose tolerance test, and I've explained the principle before. Now glucose load or glucose powder or glucose drink that's administered to the patient or to an individual, 75 grams glucose drink. Now we check for the fasting glucose. If it is below 100 milligram per dl, means the patient blood glucose is normal. But if there is an impaired fasting glucose, it will be above 100 to 125 milligram per dl. It shows that the person has an issue of impaired glucose. But if it is more than 125, now at the range of 125